Today we're going to talk about what long COVID really is, why symptoms can persist for months or years, how physicians can identify the underlying damage, and most importantly, what can be done to help patients recover. Because for millions of people, the pandemic may be over, but the journey with long COVID is unfortunately still ongoing. Hi, I'm Dr. Gary Kaplan, Medical Director of the Kaplan Center for Integrative Medicine here in McLean, Virginia. Today we're going to talk about long COVID. Back in March of 2020, the world changed literally almost overnight. Cities went quiet, hospitals filled, families stayed apart, and a virus most of us had never heard of, COVID-19, reshaped daily life across the globe. For many people, COVID was a temporary illness. It may not have been so temporary. Some people got sick for a few days, but early on, people were getting sick for weeks. But they recovered. But for millions of others, that wasn't the end of the story, even though the infection cleared. Weeks later, sometimes months later, new symptoms began to appear. Crushing fatigue, brain fog, shortness of breath, racing heart rates, pain, strange neurologic symptoms that doctors struggle to explain and unfortunately more too often dismiss. The condition we now know is long COVID or post-COVID syndrome. Today, more than 5 years after the pandemic began, we now understand long COVID is not rare. In the United States, more than 20 million people have experienced long COVID, and roughly 10 million Americans are still living with the symptoms today. And the symptoms can be remarkably diverse. We've recorded to date over 200 different symptoms affecting the brain, the immune system, heart, lungs, the nervous system, even our metabolism. For some people, long COVID means persistent fatigue, cognitive slowing. For others, it's disabling autonomic dysfunction. There's balance between the autonomic and sympathetic nervous systems, so digestive problems, problems with maintaining your heart rate. In others, it's severe pain, shortness of breath, immune system abnormalities that resemble other chronic inflammatory diseases. In fact, what we're learning is that long COVID may be one of the largest post-viral chronic illnesses in modern medical history. But there is hope. Over the past several years, researchers and clinicians around the world have begun to understand the biological drivers behind the persistent symptoms, from immune dysregulation and inflammation to viral persistence to disturbances in the autonomic nervous system. And as our understanding grows, so do the possibilities not just for diagnosis, but for treatment and, more importantly, recovery. Today we're going to talk about what long COVID really is, why symptoms can persist for months or years, how physicians can identify the underlying damage, and most importantly, what can be done to help patients recover. Because for millions of people, the pandemic may be over, but the journey with long COVID is unfortunately still ongoing. Okay, so let's first just get clear about what the difference is between COVID-19 and long COVID or post-COVID syndrome. COVID-19 is the initial infection, and by the way, make no mistake, it is still with us. COVID is still common. Basically, it looks like it has a diurnal variation, meaning it heightens it twice a year. It waxes and wanes, and it's not seasonally dependent, unfortunately. It comes with fever, cough, fatigue, body aches, and it's evolving as different types of viruses emerge, all related to COVID-19. Long COVID happens, however, when the symptoms persist for months after the infection. It's not contagious, it's not in your head, and unfortunately, it's not rare. Long COVID is when the body has trouble resetting after the virus. And the virus can damage a whole bunch of things. The immune system stays hyperreactive. The nervous system becomes unstable. Energy production within your cells drops. Blood vessels don't function normally. It's a whole body condition. For most people, it may last only a few months, but for others, a year, 2 years, even longer. Recovery is often what we would refer to as nonlinear. People have good weeks and bad weeks, which makes it all the more confusing because you're feeling great or relatively great for a week or so, able to get back to many of your activities, and then you crash. And that also can last for weeks, and it comes and goes. Studies suggest that about 10 to 30% of people who had COVID develop lingering symptoms. That means millions of people worldwide. So the other thing I want to make sure you understand is that we now understand the disease enough so it's possible to prevent the occurrence of long COVID. All right? Paxlovid, the antiviral agents, actually seem to reduce the risk of developing long COVID by about 15%. So getting diagnosed properly, knowing if you've got a flu or just a common cold or you actually have COVID is extremely important. So early testing is important. The other thing is, if you have COVID, if we treat you with Paxlovid and combine it with metformin, a drug that was commonly used for treatment for diabetes, metformin for 10 days in combination with Paxlovid looks like it reduces the risk of developing long COVID by upwards of 85%. So you can protect yourself. You can protect your immune system. Obviously, the other things that are extremely important, good sleep, good exercise patterns, making sure that your nutrition is proper for you. So there's lots you can do to prevent the occurrence of long COVID and not end up disabled, as so many unfortunate people have become. And the symptoms are like all over the place, right? As I said earlier, we've documented well north of 200 symptoms. The top ones that we see are severe fatigue, brain fog, difficulty, focus, and concentration, dizziness when standing. This is kind of a postural orthostatic tachycardic syndrome, where you'll stand up, your heart rate will zoom up because it's not able to keep the column of blood up to your brain appropriately, and then you start to feel faint, and sometimes you do faint. Racing heart, apart from those episodes just from sitting to standing. Anxiety, generalized and unexplained. Sleep problems, falling asleep, staying asleep. A sense of shortness of breath, joint or muscle pains. Some of the strangest symptoms we've seen, people talking about an internal sense of vibration, burning skin, sudden food intolerances, loss of taste that lasts for years, unusual nerve pains, and severe histamine reactions. So it can feel bizarre and it can feel frightening, and because the symptoms vary so much from patient to patient, it can easily be dismissed early on. And patients frequently go to a multitude of physicians because also a lot of the standard testing is all normal. So physical findings aren't all that much because most of your complaints are subjective. Fatigue, the pains, sleep problems, but the tests are normal, physical exam is normal, and your physician is left not knowing what to do. So here's the key thing to take home. The virus may leave the body, and in fact does leave the body, but the impact on your immune system and your nervous system remains. Long COVID is not usually an active infection, though there are some studies that have suggested that there is still some active disease present in the gut microbiome of some people who complain of long COVID. But really, it's about dysregulating your entire body. So what gets nailed? The immune system. The immune system overreacts, it underreacts, and as such, you can become more susceptible to more illnesses, or you can become just overall inflamed. It can attack your brain. It can attack other organs in your body. Blood vessels, the lining of the blood vessels in particular, get damaged. So what can happen? Well, you can have problems with blood clots. You can have problems with oxygen moving into the blood in the lungs. And that can be tough to diagnose because some of our standard testing for that doesn't show that. So you need some specialized tests for that. It's the research that has shown us that this is happening. But you're short of breath, not because you're crazy. You're short of breath because the oxygen isn't necessarily getting into the blood the way it should. So it affects the ability of the blood to carry oxygen around, but it also, more importantly, affects the ability for oxygen to get into the blood to begin with. The autonomic nervous system, the sympathetic, parasympathetic. This is this business which controls your heart rate, your blood pressure, your digestion can become unstable. So bloating, gas, sensitivities to food you didn't have before. This is part of the development of irritable bowel syndrome after this disease. This is also why people feel dizzy and faint or anxious, because heart rates start pounding, all right, because you've lost proper parasympathetic, sympathetic balance control of it. And the body goes around and says, okay, my heart's really fast. Why? I must be anxious. Even though, in fact, there's no reason for you to be anxious other than your heart rate going fast. So it can become a very challenging situation. Energy production, the mitochondria, the energy sources in our cells, the factories misfunction. They don't produce the energy they need to. The end result is chronic, exhausting fatigue, difficulty, focus, and concentration. And why does it look like other chronic illnesses? Well, guess what? Because it overlaps with all of these conditions, because physiologically, much the same thing has been happening in all of these other diseases that we didn't recognize previously. So with regards to chronic fatigue syndrome, this has been a blessing in disguise, because it's now given us great insight into the physiologic problems that are going on in people who have been suffering with ME/CSF for years. POTS, again, another level of insight as to what's gone on neurophysiologically in these conditions. Mast cell activation syndrome. Mast cell activation syndrome is where there's a dysfunction in the innate part of the immune system, that's part of the first responders, where we see overactivity of the mast cells, which when they release their chemicals, you have problems with rashes, you can have problems with chronic pain, you can have problems with sleep disturbances. So mast cell activation syndrome all by itself can create problems, and instability of those mast cells, hyperreactivity of those mast cells can be caused as part of the post-COVID syndrome. Autoimmune diseases. We can see thyroiditis occurring, thyroid disease occurring as a result of autoimmune trip-off, but we can also see other issues such as PANS-PANDAS being caused by this disease. So the problem with post-COVID is it's not a thing, it's a whole body disease, and you have to be able to evaluate the entire body in context in order to be able to start understanding how to fit this together and treat it. There's another thing you have to understand about long COVID, and this is a little bit complicated. Frequently, the reason we get sick and stay sick is because the immune system in particular was already weakened. It may have been weakened by toxins, such as mold toxins, such as pesticides, such as heavy metals. It may have been weakened from childhood with adverse events of childhood, child abuse. So we may be already dealing with a weakened immune system, and then this, like a game of Jenga where you keep pulling out blocks, pushes you over the edge. So it's not infrequent that as we're treating people and working them up, we find that there are other underlying problems going on. And you've got to create a program that addresses all of that. So COVID may be the last block you pulled out before everything fell apart. But there's a number of our patients that actually have been struggling with low-grade chronic tick-borne diseases, such as Lyme disease and Bartonella. The body may have kept it in check up until the point where one more virus comes along and that throws the whole thing out of balance. And now the other infections emerge in addition to, because of the damage that COVID has done to the immune system. We can see reemergence of other viral infections in individuals. We can see reemergence of other diseases such as mycoplasma pneumonia in a number of our patients. So the challenge is, COVID may have been the last straw that broke the camel's back. So there may be a whole bunch of other things that we need to look at first, or in addition to, and not just focus on the last event. So we have to look at the totality of what's been going on with you and treat accordingly. So there's no long COVID test, right? Diagnosis is about identifying inflammation within the immune system. Diagnosis also includes inflammation within the central nervous system, whether or not there's autonomic instability, which we test for in terms of tilt table testing and also looking at gut motility issues, circulatory changes, getting cold hands, cold feet when you stand up, nutritional and mitochondrial deficits, fatigue, problems with maintaining your energy, being able to eat your food and digest your food. So it's not about looking at one system. It requires that we look at the whole system. So the key is not asking, do you have long COVID, so much as which systems in your body have been destabilized. It's not like diagnosing strep. We culture for strep, you got strep throat, we give you the antibiotic, you're done. In this situation, we have a disease which has impacted multiple systems within the body. So one of the challenges with long COVID, as I had mentioned earlier, is lots of symptoms, not lots of physical findings, meaning your physical exam is going to be pretty much normal. Additionally, your lab test may be normal, because if you don't do the right test, you don't get the right answers. But certainly just doing a standard blood count and looking at liver and kidney functions and thyroid may not even begin to scratch the surface of what needs to be done to really diagnose you and find out what's happening. There are specialized tests that can look at patterns of inflammatory molecules, such as interleukins, that can help us understand whether or not there's been damage to the innate immune system. There's things that we can test for to look for damage to the acquired immune system, that is the antibodies that you produce, and you've got to ask the right questions in doing that testing. So you've got to understand that the testing has to be kind of a little bit outside what we normally do. And we can look at epigenetic testing, we can look at metabolomic and proteomic testing. These are all specialized tests that we have incorporated into the work that we do, but help define what the condition is and what's going on with you. There's also specialized testing that can help us understand whether or not there's dysfunction in the immune system itself. So you have to work with somebody who understands this disease, and you have to work with somebody who has access to the testing that's necessary in order to help fully characterize the disease and get you the treatments that you need in order for you to fully recover. And we're going to have to address all of those systems in order to be able to get you better. So while there's no single magic pill, people can recover. But it depends on doing a complex treatment plan. And complexity doesn't mean lack of solution. Complexity just means we have to be thoughtful and document all of the issues that are going on with you, and then design a comprehensive treatment plan to address all of these. This has to be a personalized medical program. It's not one size fits all. Simple as that. Now, there are some newer techniques that we've been using and have been utilized by other centers, like therapeutic plasma exchange. Therapeutic plasma exchange is the ability to remove a lot of the autoimmune factors that may have been tripped off and inflammatory factors that may have been tripped off. And indeed, it has been very successful for a group of people with long COVID. For everybody? No, because there is nothing for everybody. You have to individualize your treatment plans, and you have to have access to the technologies in order to be able to help people. So unfortunately, most physicians are fairly limited in what they can offer you and how they can test. So they miss the totality of what the problem is, and they miss being able to provide you with a really comprehensive solution. So don't think of long COVID as one disease. Think of it as a multi-system problem. So treatments have to be individualized. Can you fully recover? Yes, you can fully recover, but it takes time, it takes patience, it takes a multi-layered approach, and it takes the right support. I've treated people who are unable to work, unable to exercise, struggling to function. And with targeted treatment, they regain their lives. Recovery is possible. Not going to happen overnight, but it actually happens. Recent research has shown that loss of taste may be linked to missing proteins in the nerve signaling. The damage may be not so much damage to the nerves, but damage to the supporting tissue around where the nerves enter the nose. Brain inflammation in COVID appears more intense than in flu. These studies validate something important. Long COVID is biologic, it's measurable, it's real. So 5 years ago, we were reacting to a crisis. Today, we understand much more. Long COVID is complex, but complexity is not chaos. When you identify the patterns, you can treat the symptoms. If you're suffering, you're not imagining it. You're not alone, and recovery is possible.